right about now. So, if you don't know who I am, my name is Bill Clearfield. I am a physician in Northwest Reno, Nevada. I've been here for about 10 years. Um, Tonight, we're going to be speaking about peptides, and we've been using peptides in our practice for about 15 years, maybe even longer. I sort of forgot the uh, the length. Can you hear me online? We okay? We're good? Okay, good. Okay. So peptides are a whole different world, and they're really a fascinating way to take care of an alternative way to take care of different types of problems. So we're going to start with the basics. What are peptides? Peptides are amino acids, tiny proteins. They have two groups of proteins with a side chain. And for some reason, I can't. Yeah, okay, I can minimize that. Okay, with a side chain. So they all of the peptides look like this structure in the right on the right bottom. They have different molecules at the bottom where it says side chain and carboxyl group. Fortunately, my screen blocks out the pointer when I get to the pointer, so that's not going to work too well. Essential amino acids are exogenous to the body. These are proteins that we need to take in. That's why we have to eat continuously and drink continuously. You can get it intravenously. You can do it through the skin, through creams, or with liquids. There's 9 essential amino acids. We know histidine becomes histamine. Leucine is a protein. It's actually an aging protein. And a little bit later, when we start talking about anti-aging agents, when you restrict leucine, you will actually slow down aging. Methionine is your substrate for your B vitamins. And tryptophan is your precursor for your calming brain chemicals, calming neurotransmitters, and the substrate for even some medications, most notably SSRIs, Prozac, and the like. And now we're not moving. So, and great. Okay, non-essential amino acids are proteins that we have to take in. We have to eat, we have to drink. The main ones are here. You may have heard of arginine. That's part of growth factors, and it's part of growth hormone. Glutamine deals with the lining of the GI tract. Tyrosine is the protein that will form the backbone for the thyroid molecule. Non-essential amino acids or conditional amino acids are not essential except at the times of stress. And again, things like arginine that deals with growth, as does ornithine, and serine and proline. 2 or more proteins, amino acids linked together by a chain is considered a peptide. If you have more than 50 amino acids, that is considered a protein. If you have less than 50 amino acids, it's considered a peptide. Oligopeptides are substances with less than 20 proteins. And the shape and sequence determines the type of amino acids to determine the peptide's function. So this is kind of a schematic. So proteins are little pieces of like Lego, and peptide are maybe up to 50 Legos strung together, and proteins are more than 50 Legos strung together. You think of it as that. So there's 7,000 known peptide sequences. 500 of them have some therapeutic value, and there's probably more than 60 since I've done this of FDA-approved medications. The first peptide was insulin that was discovered in 1923. Peptides address things like immune dysregulation, inflammation, and reactive oxidative stress, which is aging of cells. And we use them in different types of combinations. We use them for endocrine and neuro immune issues. So issues like traumatic brain injury, joint injury, infectious diseases, chronic obstructive lung disease, cystic fibrosis, irritable bowel syndrome, Crohn's disease, and some general issues. So sleep, memory, depression, anxiety, cognition, cellular rejuvenation, and pain relief. So what's the difference between a peptide and a hormone? Hormones act on the center of the cell. Peptides act on the membranes or the edges or the structure of the cell. Hormones activate genes. Peptides activate the cell to do something. Hormones synthesize proteins, and peptides are quicker of action. Hormones act slowly and globally throughout the whole body. And what we've learned is that hormones can be generated in different areas of the body, particularly in the brain, independently of where they're generated in the rest of the body. Particularly things like thyroid. So thyroid is the gland in your neck. Progesterone, which is one of the female hormones, but it's actually can be generated in the brain independently, and it protects the brain, especially in times of stress or injury. So we want to start at the beginning, and the beginning for peptides is growth hormone. So most of us now know what HGH is, a growth hormone. But in the late 1980s, early 1990s, it was a thing of mystery. So growth hormone is 191 amino acids. We already talked about what an amino acid is, that are linked specifically in a manner in a specific order. And they liken it to Legos. So you see the car on the right, the windmill on the left. If we buy a box of Legos with 191 pieces in it, and it looks like on the box, the car on the right, and we put it together exactly via the instructions, we get this car. And that's what growth, that we're going to consider this growth hormone. The thing in the center is the growth hormone's the chemical structure. Growth hormone stimulates growth and cell reproduction. When you're young, it tells you to grow. When our bone plates fuse and we can no longer grow up, when we grow out, we need growth hormone to generate growth factor preserving substances. So growth hormone is produced in two places. In the pituitary gland in the brain. It's stimulated in the brain from the hypothalamus, which is a little tiny structure in the brain, to the pituitary via something called growth hormone releasing hormone. It's also regulated by something called somatostatin hormone, and so that's a regulatory mechanism. It's also generated in the stomach via what's called the ghrelin pathway. And this produces growth hormone reproducing peptide, which stimulates the anterior pituitary to also produce growth hormone. And this is what the GLP-1s, which are all popular now, have come from a derivative of this ghrelin pathway. Growth hormone is generated at night during sleep between 10 p.m. and 4 a.m. And so we want to use that when we dose things. We want to work with nature. Growth hormone stimulates growth in all of these tissues, it stimulates issues with brain function, the pituitary gland, the liver, sex hormones, cortisol, stress hormone, and thyroid hormone. Benefits of adequate growth hormone are all of the things you see here. In the heart, it enhances heart function. It protects against strokes, heart attacks, irregular heartbeats, shortness of breath. It metabolizes fat. It changes white fat, which is the belly fat, into brown fat, which is the fat that we can burn. It reduces the risk of osteoporosis or thinning of the bone. It increases bone healing, and it improves sexual function in both men and women. It improves the immune system. It increases erythropoiesis or red blood cells, which carry oxygen, which is the reason we get more energy from growth hormone. Also testosterone. It increases and intensifies new red blood cells and increases the production of white blood cells to fight disease. It improves sleep quality. It will thicken your hair. It will even sometimes turn your hair back to its original color. It increases collagen and skin thickness. It smooths and firms skin. It will decrease the amount of wrinkling and fine lines and cellulite. And it's vital for memory, cognition, and alertness and work capacity. In 1991, one of the first breakthroughs was the study by Dr. Rudman at Harvard. He found an 8.8% increase in lean body mass, so that's muscle tone, a 14.4 decrease in adipose or fat tissue, a 6% increase in lumbar vertebral bone density, so bone increases of bone thickness, and 7% thickness in the skin, and you used 0.03 milligrams per kilogram 3 times a week. So about 2 units per week. This was done over 4 months. IGF-1 is the usable portion of growth hormone, and this is what we use for our screening method because it's more stable. And so growth hormone has to convert in the liver to IGF-1 for it to be usable. And IGF-1 is what does the work of growth hormone. So without that conversion, if there's liver damage, or if there are proteins that block or cytokines that block the conversion of growth hormone to IGF-1, we will get difficulties with organ development and development and growth of the brain, vasodilator, usually the organs, kidney function, and ovarian folliculogenesis. Interestingly, though, the bony structure will if it's in a child, will continue to grow even though the organs don't grow in proportion. And this is acutely seen in autistic children, where we get high growth hormone levels but low IGF-1 levels. Some of the clinics in the New York City area actually treat the autistic kids with IGF-1. You would think that would make things worse because they have high growth hormone levels, but that conversion, the useful portion of growth hormone just isn't there. So growth hormone will increase thyroid activity. It will dampen cortisol or stress hormones. It will normalize them. And we found this mostly in traumatic brain injuries. It's the first and most common deficiency in a patient with a mild, even or moderate traumatic brain injury. Within the first 48 hours, 20% of traumatic brain injury patients have some sort of growth hormone deficiency. If it's unrecognized and untreated, it can increase up to 35 to 40% a year later. And this is really the only hormone that becomes more chronic and severe over time than any of the others. Growth hormone deficiency results in issues like memory, concentration issues, mental clarity, dark moods, paranoia, getting things done, what we call executive function. That's what growth hormone deficiencies will manifest as. And again, in autistic kids, the behavioral issues, they have high growth hormone levels, it's sort of lashing out, but they don't have any way to control it. Obsessive compulsive tendencies, dark moods, paranoias are all manifestations of traumatic brain injury. And when we correct the growth hormone issues, we get improvement in memory, cognition, mental alertness, and work capacity. Growth hormone in the immediate traumatic brain time injury frame within 48 hours, along with thyroid hormone and the precursors of the pituitary. For the sex hormones, we get a decrease in mortality by about 50% when we balance growth hormone, the thyroid, and the sex hormones, particularly progesterone. Overall mortality within 30 days correction. This is for overall mortality versus a normal population in myocardial infarction patients over 3 years with no growth hormone uh, is a 3.8-fold increase in mortality from cardiac abnormalities, particularly myocardial infarctions, with those that have adequate growth hormone. 3.36 increase or 336% increase in mortality in men, and in women, 454% increase in mortality. And those women that had adequate growth hormone levels within 3 years of a myocardial infarction had zero deaths from their heart issue. This is just a sort of this isn't a total talk on growth hormone per se. We're introducing the peptides, but side effects, think page, so paresthesias, pins and needles in the hands and feet, arthralgias, joint pain. You can get blood sugar abnormalities and you can get swelling of the hands and feet. Remember, growth hormone will tell your tissues to grow. If you use too much or get too much of it, you will grow. But again, we don't grow up; we only grow out. So the only thing that can grow are your soft tissue issues. So that the hands, the nose, the head, the feet will get bigger. Long-term safety. So it was thought that growth hormone caused all sorts of maladies like strokes, cancers, leukemia, heart attacks. And this was a 28-year study, so quite long, the growth hormone registry from 1988 to 2016. And there was, again, like a lot of the other lectures that I give, put a quote on it. Nearly everything we learned about, in this case, growth hormone in medical school was wrong. There was no increased risk of mortality in children or adults treated with growth hormone, no increased risk of strokes, cancers, leukemias, or brain tumors. Legal issues. So those of you, I'm assuming most everybody here is in the Reno area, would probably know Dr. Forsythe was arrested in 2005 for dispensing growth hormone. He was acquitted of that, and actually they turned around and rewrote the laws, and he was the author of that. Unfortunately, he passed away this year. I think he was about 88. Legally, in pediatrics, a growth hormone deficiency. This is Prader-Willi is a growth hormone issue, a genetic defect, as is Turner's syndrome and idiopathic short stature. Growth hormone failure in children born small who don't catch up by the time they are 2 are usually by that time the parents catch up with them. Growth hormone deficiency usually as a result of pituitary disease, usually pituitary adenomas, radiation therapy, and trauma in adults. And there is something called Sheehan syndrome, which is a postpartum. So after pregnancy, there are some unfortunates get an infarction or almost like a stroke in the pituitary gland, and it affects their growth hormone. It is illegal via the FDA to prescribe growth hormone for bodybuilding, athletic performance, or anti-aging. So enter the peptides. So growth hormone mimetics or peptides are where we turn. So this is Bing Crosby. You've got to accentuate the positive and eliminate the negative. Remember that song? Yeah. Okay. Right. The next line, latch on. So the positives, we talked about all the positives. The negatives are really quite small. The real issue was that the athletes were, caught cheating with this stuff. And of course, then the politicians jump in and make a big kerfuffle over pretty much nothing. The next line, actually, the rest of this chorus is, in case you're interested, latch on to the affirmative and don't mess around with mystery. Okay. So growth hormone positives, and just to reiterate, lean body mass, strength, energy, sense of well-being, muscle tone, positive outcomes with traumatic brain injuries, heart attacks, cancer outcomes, autism, and schizophrenia. Negatives, again, are paresthesias or pins and needles in your hands and feet, blood sugar abnormalities, arthritic joint pain, edema or swelling of the hands and feet, addiction. So it's not really an addiction, but if you abruptly stop growth hormone after using it for approximately 6 months or longer, you will get a rebound. And of course, and then again, the legalities. So we want to take the positive and eliminate the negative. So we want to take these properties here: clean body mass, strength, energy, mood, and can we find substances that will mimic them? And this is where the peptides come in. So the peptides are pieces of growth hormone. Remember what I said, that growth hormone is 191 amino acids or building blocks or Lego blocks. So the growth hormone mimetics are pieces of it. The first one was called Semarelin. It was FDA approved as a growth hormone mimetic in 1991. And it's the first 1 to 29 pieces of growth hormone. And the symptoms that it will help alleviate are usually the main ones. So energy, strength, sense of well-being, and muscle tone. It was kind of, it was only the one, remember there was two pathways. There was only one pathway here. So it was probably about 60 to 70% as effective as real growth hormone. It came as an injectable. It was quite expensive. It's been surpassed by CJC 1295. So again, a lot of times these numbers will tell you which of the proteins that are involved. So 1295 is 1 to 29, and the 5 is a 0.5. It has a lysine molecule added to it sometimes. When it has a lysine molecule added to it sometimes, it is called DAC, or drug affinity complex. The drug affinity complex with the lysine molecule changes the half-life of the CJC from 6 hours to 6 days. So now this becomes a once-a-week injection instead of a once-a-day injection. And that's quite a bit of a boost for clinics. So we have a lot of patients who come in and get this. They only need the shot once a week, a lot less injections. The Semarelin and the regular CJC 1295 it's usually we do it 5 days a week. We like to give the patients a little bit of time off, so to get used to it. The growth hormone releasing peptides are the second half, or the ghrelin pathway. We don't use that with the DAC because it's not necessary, but this completes that. Remember, there was the growth hormone releasing hormone, the pituitary pathway, which is what the Semarelin and CJC 1295 are. The GHRP2, 6, those are older ones. The 2 had a side effect of hunger, and 6 caused nausea. It was one or the other. Those were the first 2 of the pairings. Ipamorelin and hexamerelin are newer ones, and they've sort of relieved that. Hexamerelin is FDA approved for lipodystrophy in HIV patients, so that the big sort of swollen belly in HIV patients. It's actually FDA approved for that. And then off-label for whatever else. There are immune peptides, and these were we used quite extensively before COVID. And I remembered when COVID started, that these peptides were used in previous coronavirus outbreaks. One in Morocco, I think in 2005, and there was another one, I think, in Europe in 2011. I might have them backwards. But they used the thymosa alpha 1 and thymosa beta 4, the immune peptides, quite successfully to dampen the spread of the coronavirus. So, of course, when our COVID came out, I actually wrote a paper in a local magazine about it. It was the Healthy Beginnings, which is not around anymore. It was one of those supermarket tabloids that we wrote every month. And April 2020, if you can find it, it might still be online. I wrote about thymosa alpha 1 and thymosa beta 4 and coronavirus. And then, of course, it became banned. It was banned and we couldn't get it. So we had used it for a lot of things, for immune deficiencies. We actually used it, the thymosa alpha 1 and thymosa beta 4, quite successfully to stimulate hair growth. among other things. BPC 157, which we'll spend quite a bit of time on in the next few minutes, is really a homeostasis or normalizing peptide. It's a potent anti-inflammatory. It's a fabulous quencher of GI issues. Dr. Fong is joining us.
This text.
It's synergistic with epithalon, which is an anti-aging, which slows down cell destruction. It's an anti-aging peptide, and it's become in the last 6 months to a year quite popular in the gyms with the athletes. And we've been using it for more than 15 years, and so we have a lot of experience with it. Rejuvenation peptides to BPC 157, thymosa beta 4, epithalon. DSIP is a sleep peptide, and then the growth hormone releasing peptide is semirelin and CJC 1295. For osteoporosis, we have a LGD 4033, and that's actually in pill form. And there's not a whole lot of studies on that, so we'll use that as sort of an adjunct. We don't use that straight away. The brain peptides are also quite potent. These come mostly from Russia, and cerebrolysin, we've used them quite extensively in stroke patients, along with Cmax and Selank. We use them intermittently. We'll use each one 1 month on and then 2 months off. So we'll do 1 month of cerebrolysin, 1 month of Cmax, and 1 month of Selank. And it's synergistic. All of them are synergistic with some of the other ones we just mentioned. Sleep peptides or DSIP, delta sleep inducing peptide, and CJC with ipamorelin or combos work pretty nicely. Antimicrobial peptides, LL37 is effective against Lyme cysts, viruses, fungi, and parasites, and is synergistic with thymosa alpha 1. So let's talk a little bit about BPC 157. This is my favorite, and I like this. So this was actually discovered by Pavlov. Those of you who remember from your history class, Pavlov and the dog. And if you look up here, it says, "Watch what I can make Pavlov do. As soon as I drool, he'll smile and write something in his book."
That's cute.
Ernie, okay. So Pavlov isolated gastric juice from surgically prepared dogs, and he found that it calmed the GI tract. And remember, this is Tsarist Russia, 1904. He treated dyspepsia, gastritis, diarrhea, constipation, heartburn, and poor appetite. He stimulated red blood cell production, and this was determined that so vitamin B12 was the link here, and it was found to be what was known to be called intrinsic factor, which you need to link with vitamin B12 for it to be effective. So this drug that Pavlov discovered relieved pernicious anemia, and this wasn't determined until 12 years after he passed away. So mechanism of action: it protects the heart, it promotes acceleration and wound repair, it reduces cardiac damage, it speeds up repair and regeneration of muscle and cartilage, it protects the liver, it promotes regenerative capacity, it promotes and restores healthy arteries and veins. It promotes new vascular formation. So there's a concern that it might stimulate cancer production, but long-term studies show that it does not. It stimulates nitric oxide production for energy production. It stimulates angiogenic cytokines or proteins, VEGF, FGF, and TGF beta. It upregulates anti-inflammatory gene transcription factors. It downregulates tumor necrosis factor, which is a potent inflammatory cytokine. It influences corneal or eye restoration. It is a neuroregenerative, particularly from brain injuries, and it upregulates growth hormone receptors. It downregulates leukotriene B4, which is your inflammatory proteins that are generated in asthmatics. It is also downregulates thromboxane B, which is a vasoconstrictor, which causes hypertension. and myeloperoxidase, which is a protein which is present when a cardiac plaque breaks off. And we can actually measure sometimes myeloperoxidase. Muscle tissue responds better than tendons to BPC 157, and this is due to the vascular affinity of BPC 157. We've had great success with this in joints, and we've actually had success in tendons also. One of my favorite is a young man who was a football player. He played for the University of Nebraska. 2 years before he showed up at our office, he had torn his hamstring in his right posterior hamstring, and it didn't heal. He missed 2 years of playing, and he did everything that the trainers had him do, the orthopedists had him do, the school. If you ever dealt with major athletic programs, you know they have the best of everything, and nothing seemed to work. He showed up in our office in August 2 years ago, and it was his last year of eligibility. We gave him 3 injections over 3 weeks, and miracle of miracles, it healed. And he went on to catch 25 passes, return 2 kickoffs for touchdowns, and I think he intercepted a pass also. Of course, then he went on to came back in April and injured again because he was overlifted, and he tore one of his pectoral muscles. So we now call him the dumb boy. So, there are a number of growth factors in BPC 157, and this was what creates the regeneration of the tissue. There's insulin-derived growth factor, platelet-derived growth factors, transforming growth factor beta, vascular endothelial growth factors, and growth hormone stimulation also from the BPC 157. So you can see it's quite has broad uses. As opposed to steroids block nitric oxide collagen synthesis. This is where you get your atrophy of your joints and tissues. You know, if you use cortisone products long term, we end up with deterioration of tissues. You also end up with stomach ulcers, and you end up with blood sugar abnormalities. Bones deteriorate. You get that buffalo hump. The BPC actually blocks the long-term effects of the corticosteroid injections. So someone who's had a lot of steroid injections, we can actually use the BPC to blunt some of the side effects of it. It protects the lining of blood vessels and the formation of scar tissue. In the GI tract, it revives and repairs and rejuvenates the lining of the GI tract. It provides considerable more healing than H2 blockers, proton pump inhibitors, and gastric coating agents. So Pyrazole, that's your Prilosec and your Protonix. It's useful in inflammatory bowel disease, ulcerative colitis, leaky gut syndrome, diverticulitis, gastric reflux, Crohn's disease, and persistent gastric ulcers. We've used it both in an oral and pill form and sub-Q. So we use about a half a cc every other day, or 3 days a week, or sometimes even 5 days a week, depending on the severity. And it's like an insulin shot in the belly. It prevents and reverses mitochondrial damage. So again, something that's a hot topic: mitochondrial dysfunction, energy loss, inflammatory aspects of rheumatoid arthritis, lupus, and Hashimoto's thyroiditis, and it heals wounds in the eye. Peptides are, very popular, and we for a long time used BPC 157 with our semaglutide blend. We've been doing the mini doses for almost 5 years now, long before anybody even heard of it, and we had a real head start on it. And we had this combination of semaglutide, vitamin B6, and BPC 157, and of course the FDA decided that it worked too well because we had less than 1% discontinuation rate from GI side effects with this formula, and that certainly couldn't stand. So they forced the compounding pharmacies to discontinue using it. We still use the semaglutide and the vitamin B6. Vitamin B6, if you don't know, is used for morning sickness. That's the treatment of choice now for morning sickness. Here's our plan, by the way. This is everything that we do here on the right. For this our weight loss shot. So there's a little sneak peek, and if you see the exercise there, if you remember those from the 80s and 90s, 8-minute abs, 8-minute legs, you can get them on YouTube for free now. And they work quite nicely, and they don't take too long. Also, sweet tooth killer. We like 2 tablespoons of apple cider vinegar. Make sure you use the plain. All the flavored ones have sugar in them. 2 tablespoons and 6 to 8 ounces of water, and that works pretty nicely as a sweet tooth killer. That was just a little digression because we can't put the BPC in the formula anymore. For anxiety and depression, BPC will increase serotonin levels better than an SSRI, and it's effective for acute and chronic anxiety. For cardiovascular symptoms, it improves heart failure. It stabilizes both high and low blood pressure. It normalizes blood pressure. It reduces potassium to a normal level. It doesn't lower it to a too low level, and it prevents and reverses heart arrhythmias, atrial fibrillation, premature atrial contractions, and premature ventricular contractions. There's healthy heart tip. For years, your teachers kept telling you to settle down and sit still. You can stop now. So these are all a summary of potential uses that I found for BPC 157, and they include things like Lyme disease, chronic viral disease and infections, chronic fatigue syndrome, fibromyalgia, autoimmune diseases, elevated inflammatory markers, heart disease, diabetes, allergies, mast cell activation syndrome, GI issues, stomach inflammation, inflammatory bowel diseases, leaky gut, H. pylori, dental diseases, periodontitis, COVID-19, mold and toxic exposure, muscle, tendon, and bone repair, eye inflammation, mitochondrial dysfunction, depression, anxiety. The list goes on and on and on. It's quite useful. It's not that expensive, and it's quite potent. We've used it extensively. Here's the dosing. You can get them in different doses now. There's lots of companies making this stuff and in different doses. This was the original. It was 2 milligrams in 5 ml vials. You get oral capsules in 500 micrograms, so 800 to 1,000 micrograms sub-Q twice a day for 4 to 7 days for an acute injury. We mix it sometimes with platelet-rich plasma, and we're mixing it with exosomes now also. And we'll inject it right into a joint. We'll inject it into a torn tendon. We don't usually do sub-Q daily. We'll do sub-Q 5 days a week. I've not done it IV. I really haven't been able to find a source that I would consider sterile enough to use it IV. So we don't do that. If you're interested in the references, please let us know, and I'll send you the references. Here they are. And let's talk about some brain stuff, some smart drugs next. Okay, so and memory and learning, concentration, our brains are constantly under oxygenation and chemical assault, strokes, and drugs, neurotoxins, and we want to, what we see a lot in our clinic is that patients who want to improve their focus and improve their motivation, and items that are relatively non-toxic. So if you go into your pantry, caffeine is a stimulant and a mood elevator, and it's written about in ancient Chinese and Arabic texts. Goats would consume the berries of a coffee plant, and quote, they would gamble and frisk around all through the night instead of sleeping. L-theanine is from a green tea extract. It tempers the side effects of caffeine. So putting them together, you'll get the stimulation from the caffeine without the anxiety, insomnia, and blood pressure issues. Caffeine's positive side effects includes improving speed and accuracy of performance. It reduces susceptibility to distracting information. And a good combination is 50 milligrams of caffeine with 100 of L-theanine. Caffeine has sort of a bad name now. L-theanine actually will temper its side effects. Health food store creatine, again, has become quite popular with a loading dose of 20 grams per day. It improves short-term memory reasoning, enhances oxygenation. It will improve muscle tone. We like using this about an hour after workouts. We use 20 grams a day for 5 days and then 5 grams a day after that. Usually a scoop of creatine comes as a powder is 5 grams. Bacopa enhances focus and attention, and it reduces anxiety. You want to use it with some sort of fat, avocado or coconut oil. 300 milligrams is a good dose here. Choline and piracetam is our GABA, which is the calming neurotransmitter, the calming the brain chemical. It enhances memory formation and enhances the effects of choline, enhances the effects of the piracetam. And there's the dose there. Rhodiola is part of our adaptogenic herb combination along with ashwagandha and cordyceps. It improves mood, enhances memory, reduces reaction time. It improves reasoning skills. Ginseng will improve memory, retention, and enhanced attention and focus. It reduces anxiety, enhances performance, reaction time, and endurance. There's different types of ginseng. There's Asian ginseng, which is the most potent. There's Wisconsin ginseng, which is moderate. And then there's Korean ginseng, which is less potent. So brain peptides that I already mentioned what they were: cerebrolysin, Cmax, and Selank. Cerebrolysin is an anti-inflammatory. It reduces free radicals. It reduces free radical reduction, and it modulates inflammatory cytokines. Neuroplasticity, which is it will improve the movement of brain tissue, which is how we retain the memory and facts and figures. It's neuroregenerative and it is neuroprotective. It has these growth factors, they're kind of technical. Ciliary neurotrophic factor. It counters the effects of elevated levels of fibroblast growth factor, which is scar tissue formation. Glial cell derived neurotrophic factor, and then IGF-1 and IGF-2. We already talked about IGF-1 as the usable portion of growth hormone. IGF-2 is the usable portion of growth hormone prenatally. So cerebrolysin will improve the inflammatory cascade in the ones on the left, and will increase brain-derived neurotrophic factor and interleukin-10, which is an anti-inflammatory cytokine, the two on the right. Interleukins beta-1, TNF-alpha, NF-kappa beta, interleukin-6, interleukin-2, interferon gamma are usually the usual culprits in inflammatory diseases. This is just another look at the same thing, and the cerebrolysin will show improvements in dementia, strokes, and traumatic brain injury. And again, the indications are dementia, cerebrovascular accidents or strokes, and traumatic brain injury. In dementia, 30 milliliters per day, 5 days a week orally. 147 patients, 4 weeks post-stroke, showed a 200% increase in cognitive score. Activities of daily living improved by 35% versus control, and 85% of the patients had some improvement in their cognitive function. It decreases beta amyloid deposition, which is the proteins that form with dementia, and increases synaptic density, or the chemical reaction areas in the brain, and it improves cognition and behavioral performance. This is a graph of recovery after a stroke. And in the blue, what you'll see is recovery time with cerebrolysin versus no cerebrolysin at all. And as you can see, at day 90, you have almost complete recovery, as opposed to no recovery in the untreated patients. It's almost 50% better, almost across the board. We get reduced mortality with early cerebrolysin use. We get recovered motor function in 20 to 21 days with cerebral lysin versus 90 days with the untreated group. It tempers oxidative stress, which is aging of cells, neuroinflammation, brain inflammation, destructive cytokines. So those are the inflammatory proteins, and brain cell mitochondria destruction, or the powerhouse of the cell, where the energy sources are preserved. 28 days post-traumatic brain injury, the cognitive performance with patients with adequate cerebral lysin are that of the cognitive performance with no treatment of patients that have had a stroke for a year. So you can see that in 1 month, we can recover a lot more function with the cerebral lysin. 50 milliliter doses over a cycle is preferred. We do a treatment of 10 to 20 days. After the initial course, we reduce this to 2 to 3 days a week. We do like to do, cerebral lysin holidays. We do an IM injection. You can give up to 5 milliliters at a time. We can do it IV. We usually do it sub-Q now, though, and we do the dose of about half a milliliter in 5 days a week. Contraindications are, some patients are sensitive to it. They get either irritation in the injection site. We've had very few, maybe 2 that I can think of in 15 years, have the hypersensitivity and sort of whole body rash that you get, like a drug reaction. There are reports of epilepsy. I've never seen it. There are reports of renal impairment. I've never seen that from the drug, but these are contraindications. Don't mix this with any amino acid solutions, and you need to be careful with MAO inhibitors, which are antidepressants, which you may need to lower the dose in antidepressants. 5 times the human therapeutic dose for 26 weeks showed no toxicity, no substance-related intolerability. The fetuses were not affected. There was no antibody formations, no anaphylactic reactions, and no increased incidence of cancers. It's quite safe. Here are the doses: 5 days a week for 4 weeks, 2 to 4 cycles a year, 10 milliliters a day for cognition, 30 milliliters a day to improve behavior. Post-stroke, 5 days a week for up to 4 weeks. It's acute. You can do it for the first 20 days, 30 to 50 cc's. Do it as quickly as possible. For a head injury, 10 to 50 milliliters a day, and reduce it for children by 1 to 2. This is just an algorithm for how to use it. Cmax is our second line. It's an ACTH, which is a cortisol or stress hormone analog peptide. It's neuroprotective. It protects against anxiety. It's an antidepressant, and it's an anti-pain or analgesic. It increases that brain-derived neurotrophic factor, which increases serotonin. Serotonin, as you know, is one of the factors missing in severe or major depressions. It encourages growth and differentiation of new neurons and synapses, so it helps the brain to grow or to regrow, and it's necessary for long-term memory retention. Again, for the clinicians, it will decrease the inflammatory cytokines on the left, and will increase serotonin, dopamine, and brain-derived neurotrophic factor. It will rejuvenate brain function on the right. Memory, learning, retention, relieves the symptoms of ADHD. It augments the psychostimulants, and it modulates brain development. It's much better with much less side effects than any of the drugs out there, the Adderalls or Ritalins. Anxiety, depression, memory retention and learning, hypoxic states, including TIAs, mini strokes, strokes themselves, and heart attacks, heavy metal toxicity, and pain relief. Indications for ADHD, migraine headaches, increased intellectual capacity, mental clarity, mood stability, and no high feeling. Increases energy, improves visual acuity, expands visual fields, improves color vision, and improves olfactory sense. Smells. So if you're like me, since COVID, you don't smell anything, you might want to give this a try. 300 to 1,000 micrograms sub-Q, so that's the shot in the belly once a day, 2 times a week. You don't want to use more than that. You can get used to it, or it can stop working. And you can alternate it with the third neurotrophic factor, which is SLANK, which is what we're going to come up to next. And so Salank is our third anti-anxiety antidepressant. It also is useful for opioid addictions, alcohol withdrawal. It's an immunostimulatory peptide. It modulates again in the IL-6, which is one of our major inflammatory cytokines. 5-HTP, which is your precursors of your SSRIs, dopamine and norepinephrine. It increases again that brain-derived neurotrophic factor, reduces the breakdown of enkephalins, which are anti-inflammatory agents. It increases interleukin-4, which is another anti-inflammatory cytokine, and it will reduce the ones on the right, like the others, which is our pro-inflammatory cytokines. Salank versus benzodiazepines. So benzodiazepines are, your Valiums, your lorazepams, your Xanaxes, and all of those ilk. Salank will alter the affinity for GABA cell reception, as does the benzodiazepines. It potentiates GABA inhibition better than the benzodiazepines, and it is non-sedative, non-addicting, and you have no cognitive loss. And with the benzos, you get all of those. You get the addictions, you get cognitive issues, and of course, there are all sorts of drug interactions, and they're particularly dangerous with the opioids. They get decreased breathing, and there's many deaths with the benzos and the opioids. Salank, 0. Here are the references for that, if anybody wants them. It positively affects anti-inflammatory and antiviral regulators. It upregulates brain proteins, serotonin activity. It increases intracellular antioxidants, increases blood flow to the brain, and decreases blood pressure. It alleviates anxiety and withdrawal. It exhibits a penchant for weight loss and lowers cholesterol versus the control group. It increases lymph flow to the stomach. It decreases stomach ulcer size. It inhibits mast cell activation, so those super allergies that one gets. And Salank and Cmax are a potent focus for concentration. There are the references for that. And the official indications from the Russian Health Ministry, remember I mentioned that these were actually developed in the Soviet Russia, are anxiety, depression, chronic fatigue, adrenal fatigue, antiviral, and anti-inflammatory. 2 to 3 drops of a 0.15 nasal spray 2 to 3 times a week. Rarely you get side effects. It is a good way to get it. It goes right into the brain. These are, I mentioned cytokines. This is more for the clinicians. These are the cytokines. These are some of the lectures that I've given on different topics. And you can see that the cytokines or the inflammatory proteins are common to a lot of them. So if we can find some remedies that are readily available, we don't have to go searching all that hard for each individual instance. So for autism, we get the interleukin-6, TNF alpha, and you can see for so gadolinium deposition disease. So those of you who've had MRIs with contrast, the contrast is gadolinium, and there's a small but not insignificant number of patients who have severe reactions to the gadolinium. They get all sorts of chronic fatigue issues, skin scars, brain issues also. So these are the inflammatory cytokines. Finasteride is a drug that's used for hair growth and for prostate enlargement. And there's a small, again, but not insignificant number of patients who end up with all sorts of issues, including severe depression that becomes unrelenting and untreatable almost. And these are the cytokines that are about in those syndromes. This is a chart, and again, this is more for the clinicians, of which of the brain chemicals are useful for different types of entities. As those we're looking for anti-aging. You can see the Cmax and cognitive, the Cmax and the cerebral ice for cognitive function. And some other things, neuroprotective. There are the doses for the clinicians, the conditions that we treat, and some of the other ones that we talked about. PT 141, I'll just mention, is usual for libido and sexual function and weight loss. And the other ones are the ones that we mentioned for different symptoms. This is just a chart. And a over the counter. So these are some over the counter remedies that will get similar, but not quite as potent effects as the peptides. So first line, we have progesterone. You can use it as a cream. Pregnenolone for memory, and fenofibrate is actually a drug that's used for high triglycerides. We get some neurocognitive effects there. GABA is a common neurotransmitter. Chinese skullcap is a Chinese herb. Phenylethylamine is also useful for neurocognitive effects, as is the L-theanine. For memory loss, we can add things like, again, pregnenolone, green tea extract, ashwagandha, and lacuna currants, slow thought. So these are some over-the-counter remedies that you can use in place of the peptides that we talked about, especially sometimes they become not obtainable. And so we have some. So this is old. We still run our conference, our Tuesday night webinars, 5 p.m. Pacific, 8 p.m. Eastern. If you get us your email address, we'll put you on our email list. We're there. We've been doing it since 2020. Every Tuesday night, we have an anti-aging integrative medicine webinar. And we have some of the leading lights in the anti-aging world. We've had Jacob Teitelbaum on, who's the sort of the godfather of chronic fatigue syndrome. He wrote about it in 1975. He's quite famous. We've had Peter McCullough on. He's of COVID fame. We've had Pam Smith, who's one of my teachers for hormone optimization. We've had Felice Gersh on. These are all people that, if those of you that are clinicians and go to conferences, you'll pay $2,000 for a 2-day conference to see these people, and it's all free. So if you're interested, let me know. I think pretty much everybody who's either online or here can contact us, and we're here every Tuesday night. So with that, thank you all for coming.
Thank you.
Those of you that are here, we have refreshments and snacks. Online, if anybody has any questions, or anybody here have any questions. So in the chat, can we get a recording? Yes, let me know. You can get a recording. Yes, we are recording. So yes, the answer is yes. Okay, anybody else have any questions, comments?
Doc, I have a question. I have a question. I took Bicopa because somebody told me to take it, and I got it was very powerful. And I saw that you had that up there.
Yeah.
Why would my eyes be affected?
Well, a lot of times.
Is it for your brain, Doc?
Yeah, well, a lot of times these supplements have a lot of fillers in them, and there's a lot of allergic reactions. So, we only will use pharmaceutical grade. Supplements. You get the stuff from Walmart or the dollar store.
I got it from Sprouts, and
it usually should be pretty good. Anybody can be allergic to anything. That's kind of So, okay. Okay. Well, thanks, Dr. Fong. I might have presented some of this at NOMA one time. I'm not sure. I don't remember. So anybody else?
You did at our conference at one point, but as always, you made it easy to understand with this format that you presented tonight. I apologize, I was a little late, but even jumping in late, I got something out of this. So again, thank you very much for all your hard work.
Mm-hmm. Okay, and like I said, we did record it, so I like that look you got there.
Yeah, somebody else complained about my other profile picture, so I changed it.
Is it possible to get the deck for this, Doc?
What's that?
Is it possible to get your deck that you just presented?
Yeah, just let whoever's talking, just send me an email.
It's Aaron. Okay, thank you, sir.
Aaron. Okay, yeah, absolutely. Okay, and if you use it somewhere, just at least attribute to attribute
I
it to
won't.
me.
It's more for my ex-wife. She's got a lot of these issues that I wanted to share with her.
And one last thing for those of you online, we're getting the gang back together December 4th to 6th at the Element Hotel in downtown Reno. We're having a live conference. It's 3 days. Day one is our research group from the American Academy of American Osteopathic Society of Integrative Medicine and Nevada Homeopathic Society and Nevada Osteopathic Medical Association. Um, we thank you, Bruce, for being here. So December 4th to 6th at the Element Hotel. If you need CME credits, it's 20 CME credits will be available. And so that's Thursday is research day, and they're going to be presenting a lot of the supplements and substances that they've been working with, developing a whole line of new products. That's Thursday. Friday is homeopathic day. And if you're a homeopathic practitioner and need credits for your homeopathic license, the 20 credits are accredited by the Nevada Board of Homeopathy. That's Friday, and Saturday is going to be Integrative Medicine Day. And I'm going to be speaking on my nearly 50 years of as an anti-aging physician, and I go decade by decade. I started when I was in medical school. I actually was an intern at the Pritikin Clinic in Santa Monica in 1976. Oh my God. If you don't know who Nathan Pritikin was, he was one of the first to speak out about low-fat diets to reverse heart disease. And what we did was it was all men. He had rented a hotel, and I was in medical school, and I went there as an intern for a month, and we had to get these guys out of bed and make them walk, and then they get fed on a 10% diet. And the treatment at the time, if you'd had a heart attack, was to stay in bed for 6 weeks, and they gave you sort of mush and not to get out of bed, and that didn't work. And so the Pritikin Clinic said, we're gonna turn things on its head, and some of our guys actually got better. So I was there actually at the ground floor of that in 1976, so we're going to talk about innovations in the 80s. We did some herbal remedies, and we did protein sparing modified fast, which was a big revolution at the time. In the 90s, I learned acupuncture, and it on and on all the way up to this decade where we're doing regenerative medicine. So that'll be my talk. And we're going to have Felice Gersh there. She's those of you, she's one of the leading lights in the hormone optimization world, particularly for women. And we're going to have Swahara Sedan, who's a key speaker at A4M. Which is where I got most of my education. So December 4th to 6th, please get in touch with us if you're interested. It will be virtual also. It will be online. So if you don't want to go to the Element Hotel, you don't have to. And it will be online, and we'll get credits. And it's less expensive online than if you show up, because we don't have to feed you. So with that, thank you all for being here. We'll I think I actually get who was on, so we'll get in touch with them too. Okay, so thank you all. Any other questions, comments, complaints? Going once, going twice. We have snacks and stuff for folks here. Thank you so much.
Thank you. Thank you.
Hey, good night, everybody. Thank you for being here. I really appreciate it.
Post it on. Already posted.